In this video, I want to talk all things knee meniscus, or knee cartilage as you might refer to it. We want to talk about what actually is the meniscus, how it feels if you get a tear to that meniscus. Do you need an MRI? Should you be having surgery? And if you go down the surgical route or the non-surgical route, the important things that you need to do in order that your knees can be nice and comfortable. So let's dive straight in. My name's John, I'm a sports injury therapist, and here at this YouTube channel, I want to be helping you to do three simple things. Understand your body better, get rid of pain and weakness so you can strive forward and hit your health and well-being goals. But in this one, we're talking all things knee meniscus. So really quickly, I want to chat about what the meniscus is. So the meniscus are these blue structures in here. They're not actually blue, but just for the purposes of this model, they're quite clear to see. And they're these discs, these pad discs that sit in the knee joint. Because the thing with the knee joint is it's made up of two surfaces. So we've got our big femur bone coming down to meet this tibia bone here, but they're not nice and smooth. So the femur is a bit like a dog bone at the end of it, and the tibia is like a flat, we often call it the tibial table at the top of the bone. So what these discs do is they have a few functions, but they effectively allow our bones to work on each other without causing any pain. So they're there to act as a lubricating surface between the two. But also their big role is to act as our shock absorbers as well. So as we place our foot down and we put shock through the area, they're there to absorb that shock. So very helpful structures. We have two of them that we term the medial meniscus and the lateral meniscus. You might have heard them termed as damaging cartilage in your knee. Well, there's a few different types of cartilage, but yes, they are like cartilage discs, so that's what we might think of. But, so that's the role of the knee meniscus. Now, unfortunately, we can tear these meniscus. We can do that in a couple of ways, really. Particularly younger people might do them with acute movements, sudden twisting or turning, and we get a tear in that meniscus. If we've somebody who's perhaps slightly older and more experienced, should I say, then we can just wear down these discs a little bit. That can lead to some tears happening in the area. How do you know if you've got a tear in the area? Well, I'm going to talk about a test that we can show you how you might be able to test yourself in working out if you've got a meniscal tear. But we do get these sort of distinct features around meniscal tears a lot of the time. If you feel things like clunking or clicking or locking of the knee joint, that might be a sort of prerequisite or a symptom that we've got a meniscal tear happening in the area, because the bones can't move smoothly on each other. So if you feel particularly clunky on rotation in the area of the knee, or you feel a clicking or a acute pain in that knee when we rotate, that might be an example of a meniscal tear. You'll notice I keep saying might, and I'm going to explain that a little bit further. I mentioned that there's a test that you can do on yourself. We call it the Thessaly's test. But what you're looking to do is stand leaning against something like a wall or a chair and get a slight bend on your knee first of all. Then what we want to do is rotate our body to side. And again, if that starts to cause localized pain in that area, that might tell us that we're moving towards a meniscal tear. You can then repeat that test, bending slightly further. So we only want to be getting at maximum about a 20-degree knee bend and rotate from side to side. So as I mentioned, what we're looking for here is, does that recreate your symptoms, that test? Do you feel a localized pain in that area, or a clicking, a clunking, a locking happening? Because that might be telling us that we've got a meniscal tear. And in clinic, we have certain tests where ultimately what we're looking to do is to flex and then rotate these bones on each other. Can we recreate those symptoms with that movement? Because that might tell us that we've got a problem with one of these meniscus. But really, ultimately, a lot of the time to truly diagnose a meniscal tear, we're looking at an MRI. And an MRI is something that can really chop our body up in terms of its imaging, not literally, but we can get good clear images to see if there's any tears happening at that meniscus. Now, what happens if we've got a tear at the meniscus? It used to be believed that we needed surgery, something that we called an arthroscopy, which is a small surgery into the knee to repair that tear. We can either repair it, they can either cut it away, trim it away, the damaged area, or ultimately remove the whole meniscus if that's required. But what we also know is that that's one option, because actually as time's moved on, we've realised that perhaps we can also do the non-surgical route and we can look to rehab the area. But either way, what we need to understand is there's key principles that we need to do. And the good news, I suppose instantly when we hear surgery, people might think that's bad news. The good news around the surgical option is that as far as surgery goes, and I'm not a surgeon, but do work with a lot of surgeons and obviously a lot of post-surgical cases, this is about as mainstream as the surgery gets. The rehab time isn't too extensive. We're probably looking at 6 to 8 weeks. So it's not a drastic option, but also there are other options that can be explored. So if we choose not to do the surgical option, or we don't think that the knee warrants it, because that's what we need to decide. And when we're going for an MRI scan, we need to already be thinking, would we want the surgery if it's required? So if you're in acute pain and you've tried other options perhaps, and surgery is the final option, then there are some plus points. It can be a very helpful outcome, and ultimately it's not too invasive. But if we haven't tried some other options, there's some key principles that we want to follow. So what are they? And these are also the same principles that post-surgery we're looking to achieve. First of all, we want to make sure that we've got good flexibility around the knee. So the muscles that cross or affect the knee, and in particular, there's 3 big players. We've got the quadricep muscles living on the front, the hamstrings muscles living on the back, and the glutes muscles that really control the overall stability of the knee. So firstly, how do we test the flexibility of that area? Well, for our quadriceps, what we want to do is lay on our front, and we look to pull our foot up towards our bottom. You can grab hold of that ankle, and you can look to pull that ankle in towards your bottom. And this should be showing us if we've got good flexibility. If you really struggle with that movement, or if you can't grab hold of that ankle, or if you find it difficult for the foot to touch the bottom, that's an indicator that we might start to be getting some issues with those quadricep muscles. But I should add that if you are someone who's suffering with knee pain, this is quite a difficult movement, so you might find that this aggravates your knee. So we can modify that exercise, or that stretch if you like, by laying on our side and performing the same movement. But here it enables us to cheat a little bit. We can move our hips around to a position that's comfortable to allow us to feel that stretch. What about the hamstrings, the muscles on the back that cross that knee? Well, here what we want to do is lay on our back and lift our leg straight up in the air. The key thing here is that you're keeping that leg nice and straight, and that the other leg is laying flat on the floor. We'd like to be able to achieve 90 degrees of hip flexion, and that means that the leg is straight up. But if we can't achieve that, if you suddenly feel a big pull in those hamstrings, another indicator that we might be feeling a little bit tight in that area. And what about the glutes? I mentioned that these are a big player in controlling the stability around that knee. So this is something that we want to check out our flexibility. Well, here what we're looking to do is bend one leg, and then the side that we're looking to test, take the foot of that leg and place it onto the bent leg, and then lift that knee up towards the chest. Now, what we're looking at here is that the glute of the side that we're being stretched is actually the other leg where we can check the range. Can we lift that knee up to about 90 degrees? And again, if we start to feel a big pull in the glute that we're testing, then actually that starts to tell us that we might have a lack of flexibility in that area, and that's something that can be addressed. So if you found that you've got a lack of flexibility in that area and you want to improve your flexibility in order to improve these knee issues, what can we do? Well, the good thing is those tests that I've shown you there, we can just take these to be a stretch. So we can take us to the position where we feel the bind of those muscles, where we feel those muscle fibers starting to be stretched, and hold that position for 30 seconds. And that's the key. You're looking to hold that position for 30 seconds, as you would have seen in the videos. And also, once we improve the flexibility, one of the key things that we want to do is improve the strength around the knee. So instantly we might think of the muscles that directly affect the knee, but one of the big players are those glute muscles. So what we want to be doing is having the ability to perform some strengthening exercises that work our glutes to control the overall stability of the knee. Because what we'll find is if our knee collapses in, then that can be putting excessive strain and rotational forces through that meniscus. What we want to be able to do is have good stability of the knee. So here we've got some glute exercises that you can try. Now, the reason I like these glute exercises to start off with are that actually you can see that we're not putting pressure on the knee through weight bearing. So we have our clam exercises that I call hip abductions or wipers, exercises that we're looking to do that will really target those glutes without impacting the knee. And then once you feel comfortable with these non-weight bearing exercises through the knee, we can start to factor in some loading exercises again. So these might be things like squats, for example, but the key thing with this is that we only want to be going down as far as we haven't got pain. Now, hopefully over time, as we get stronger and more flexible, you'll be able to get deeper into those squats. Another exercise might be something like a lunge exercise, where you're looking to lunge forwards and work those muscles. Or also a really good exercise around the glutes and the back of the knee is our glute bridges or our hip thrusts. Important exercises to really work that back chain in order to be strengthening the whole area. And so there it is. What I've tried to do is summarize some of the key principles around meniscus. What are those menisci? How can we actually be testing whether we think we might have a tear? If we've got a tear or suspicion of a tear, what we think we should do. And we're two options that we have to take, which is the surgical option or the non-surgical option. And again, there's plus points to both. So I hope that that video has been helpful for you. And I hope that it's given you things that you can go and try or a greater understanding around that knee area. If it has, and you've made it through this video and you think that this has been helpful, the biggest favor you can do for me is smashing that like button, because that's going to help other people suffering with knee pain to get a hold of this content, and hopefully you can be helping them as well. So go smash that like button now. And if you do like this style of content, then why not hit that subscribe button? It'd be great to have you as part of our community where I can keep you updated on new videos as soon as we drop them. And here's another video to help you on your journey. I look forward to seeing you on the next one.